Anne didn't hesitate. When I asked her what it would take to make caregiving easier, she said one word: trust. Not time, not money, not help, but trust. Maybe you have felt it too. You know you need support, but you've had caregivers who've overstepped, doctors who haven't listened, or family who thought that they knew better. After enough of these moments, it just feels safer to carry it all yourself. But let's pause right here. What if the problem isn't that you don't want help? What if it's that you've never had help that you can trust? And what if that could change? Today, we're talking about what it really takes to let others in without losing control, without compromising care, and without giving up your voice as their caregiver. Hey, Christian Care Companion. Welcome to Dementia Caregiver Support for Christians, the podcast where we talk with spouses, adult children, and other family members honestly about the tensions you face, the decisions you carry, and the faith that keeps you going. This is where biblical truth meets practical caregiving without guilt, without fluff, and without overwhelm. And if you need more help mapping this out practically, I'm inviting you to join me to our new free workshop on August the 9th at 12 p.m. Eastern. It is called 3 Unusual Mistakes That Keep Christian Dementia Caregivers Overwhelmed. Here we are going to unpack the surprising things that quietly keep you stuck and how to take a faithful, clear step forward in your dementia caregiving that will bring you peace. I invite you to register now at thinkdifferentdementia.com/WSL. And now I invite you to listen to my conversation with a member of our community, Anne, who is struggling to trust others and protect her loved one. Hello, Anne. How are you? Let's say it is 6 months from today and things are easier in your caregiving journey. What would it take for you to get there?
I would need some more help,
Okay.
somebody else I could lean on.
So, what is standing in your way to achieving that needing more help?
Trust.
Ooh, tell me more.
Yeah. I'm looking into hiring a company that I already have. I get a certain amount of hours per week through the VA, but when they were coming to me previously, up until 2 months ago, they could cook, they could do so many things. And then somebody realized that the VA is paying for my services and they cut back on what they can do. So I have said, okay, if they can't cook. The main thing I'd love for them to do is for the 4 hours they're here, just be with Mike and get him to do some exercises. One respite care lady I have takes him to the pool, weather permitting now.
Mhm.
And that's the main thing that needs to be done. But I do need somebody that when I interact with him, like this morning, and he upsets me and he does things that are not nice, I should have somebody to talk to. You're good at it when we're not in this program, but somebody I can just, vent to about it. My nephew is stepping up and he will be helping us with financials and medical stuff for me when my time comes and needs. He's coming to visit. He lives in another state.
Okay.
So, that'll be a help. And I'm thinking today for the first time, his wife also interacted with. He's a sweetie. She works at a preschool and She and I just laugh about what the
Mm.
her
What the little
kids.
kiddos are doing?
Yes,
For sure.
yes. She stopped calling them her kids. I bet you her sons didn't like that after a while,
That's
even though
okay.
even though they're in their late teens now.
For sure.
So now she calls them all her littles.
Okay, her littles. So,
Yeah.
Anne, you said something very interesting that I really want to circle back to.
Thank you.
You said right at the beginning, when I asked you what would it take to achieve that, you said trust.
Yeah.
Trust in what? Trust in who? Is it
Yeah.
trust in the process? Is it trust in the particular company? Is it trust in the particular humans coming into your house? Tell me a little bit more about what you mean when you said trust. What would it take to achieve the goal of needing more help? Your automatic response was trust.
Yeah. In the past, I've seen how doctors work to keep a body alive, not a quality of life. I've seen how people, you give them an inch and then they try and tell you what to do and how to do it and such. And I know Mike well enough that I don't want somebody coming in and starting an argument about his care. Uh,
Okay.
yeah.
So, can I paraphrase that?
Yes, please.
Okay. It sounds to me, and please correct me if I'm wrong, that you don't trust the healthcare system.
Oh, no. I took a course on being hospice care and
Uh-huh.
realized I'm not
But
that able to do that.
but
And the
but
stories
we're
that, yeah.
let's talk about this real quick because you said I asked what about trust? What? You said the doctor's working just to keep a body alive. People coming in and taking an inch and then, giving an inch and then taking a mile, and people coming in and second guessing your decisions with Mike. Those were, in essence, the three things you said. And what I'm proposing to you is that what you actually vocalized from the outside looking in is that you don't trust the system.
Our healthcare system?
Hmm.
No, not at
Okay.
all.
Okay. So that is a very important thing for us to briefly unpack because I think it's a very valid concern. Okay. So
Yes.
might I unpack that for you for a couple of minutes?
Okay.
Okay.
Keep in mind we have to use the VA.
I understand, and your hands are bound with the VA, but that does not mean that you do not have a voice.
Oh, yes.
Okay. So just because you have to use the VA does not mean that you cannot direct the care.
Mhm.
Okay. So recently, I have a couple of private clients that I work with, and the healthcare system has now resulted and caused significant family dissension because there are three young men with the mother who has young adult onset. She's not a young adult anymore, but she's had it for the last 11 years. They're in their early 30s. One of the sons is willing and able and has the capacity to be the hands on caregiver. And two of the boys went to the doctor's office with their mother, and the healthcare provider said it's time to put her in a facility. Okay. So now we have a perfectly capable and able adult son willing to provide care for his mom, that the other brother who is married now has it in his head the only best recommendation for her is that she go to a facility. She has the resources to provide for care at home as well as in a facility, and she has a provider, a care partner who is willing to keep her at home and take care of her at home. And that healthcare provider, when they come from that perspective that that is the solution, she's not hard, she's not unsafe, she's not walking out the door, has caused so much dissension in this family that it is likely going to end up in a court of law. So, the reason I bring all of that out for you, Anne, is the following. You are Mike's power of attorney. You are his healthcare power of attorney and his gerbil power of attorney. You know your husband extremely well. You've been married
58 years.
58 years. Number one, you don't look old enough.
Thank you.
I know, right? And number two, you know Mike the best. The doctors can make a recommendation only.
Mhm.
They cannot make they cannot require you to do anything.
Yes.
Okay? You do have the authority and the involvement to make the decisions for him. So what I want to give to you today as a gift is you do have the power of directing Mike's care. You know
Thank you.
what quality of life looks like. There's
Mhm.
quantity and quality of life,
Definitely.
right? So you know what quality of life you want to have with Mike.
And
And
what he
because I've
requests.
seen some photos of you guys recently, he still has very good quality of life. And unless he wakes up, tomorrow morning with the Lord, he has some time left, right?
Point.
What I want you to do, though, is I really want you to sit and reflect on when these decisions, if they need to be made, when these decisions need to be made, have pre-thought through what you are going to do.
Mm.
So what I mean by that is you already know your husband. Would he want a feeding tube? Yes or no? I'm not asking
No.
for an answer. I'm
Good.
giving you some prompts. Would he
Yes.
want a feeding tube? Yes or no? Would he want to die at home? Yes or no? Do you feel like you would want him to die? Yes or at home? Yes or no? If he has a massive heart attack today and you go to the hospital and they say to you, what do you want to do? What are you going to do? Are you going to say, you know, do what needs to be done, which is what I would recommend because it's a new thing, right? Do what
Yes.
needs to be done, but know if things go south.
But ask questions about what they're going to recommend and what they would do for a family
Right.
member of their own. Yeah.
Exactly. So
Yeah. Get the options.
think through all of these things. And I'd encourage you, and unfortunately, I don't remember the episode, but when my mom passed away, but I did an episode in the podcast, it would have been at the beginning of March, going over the fact that because I had thought through all of the contingencies of what might happen, not the specifics,
Right.
but if she had COVID and needed to go on an event, what would I do? If
Mhm.
whatever. So when my mom coded in that procedure, I already knew what to do and I didn't even think about it and I told them stop the code. Okay?
Right.
So what I'm asking you to do, sweet lady, is use this time while things are still pretty level to
Yes.
think through your decisions about what you would do to direct Mike's care. Do not let anybody tell you to do something that you do not want to do or do not believe is right.
Yes.
They can only make a recommendation, they cannot make it a requirement. And make sure that you document for
Mhm.
yourself as well as Mike preferences, what you'd like, and
Yes. We've been doing that. Yeah.
ensure that your nephew who's involved
Is on board.
knows.
Mhm.
Not on board. He does not need to be on board. He just needs to be able to implement.
Okay. Okay.
It's
Have
not his decision to make. And that
have
is the thing. You need to be very clear. Like, these are our decisions. Your job is to implement what we want.
exactly, and
It's
Mike and I
not
have discussed quite a few. Have you ever seen the paper? It's available online. It's a little booklet that a friend, in Alzheimer's, had given me. It's called 5 Wishes, and it's
Yeah,
about end of life.
I have seen 5 Wishes. It's a very great resource.
Yeah, for discussion
Absolutely.
and everything too.
Yes.
Yeah.
So to close our conversation, what
Mhm.
is one thing based off of what we just talked about today that you are going to perhaps do to take you closer to that goal of trusting in this caregiving journey?
Mhm. Taking over more control of what might happen, by more research and such. And I will be sending you an email and, talking about something else with his healthcare to
Okay,
make sure we do it right
that
as
sounds
we
perfect.
can and keep a lot of
Next,
prayer going. God bless you all.
you too, sweet lady. People who are really benefiting from the community are the people who joined earlier on before
Yeah,
they need it and
yeah,
that have been active and are participating in the community because then they already know what questions to ask and they have a place to come and they're not constantly wondering, what do I need to do? How do I need to do it? So people listening are interested in tapping into or learning about the community. I'd invite you to just go to the website, thinkdifferentdementia.com. There's a link for you to schedule a 20-minute call. There's no pressure. I'll serve you regardless of whether you join the community or not. But it is a way for you to take this relationship a little deeper, a little bit more hands on support, because really the research also shows it's longitudinal support over time.
Absolutely.
Yeah.
For sure. I would highly recommend Lizette. She's awesome.
Tracy, I appreciate that endorsement.